This is Dr Albusoda. I am a gastroenterology consultant. Today we're going to talk about a topic that patients ask quite a lot in clinic, which is mainly regarding diet and constipation. So today we'll talk about a few tips that people find helpful. For example, for you to actually be able to open your bowels nicely and without effort, you need three things. So first of all, we need reasonably soft stools. It's very difficult to push rock hard stools, for example. The other thing is that even if you have soft stools, you need a bowel that's actually able to push the stools. And that is really the motility, the movement of the bowel and its ability to actually take the stools from the right side of your bowel towards the left side. And that is really the motility. The third factor is once the stools reached to the end, you need to be able to coordinate the muscles and open the bowel accordingly to actually get rid of the stools. Diet might help you with one thing here really, which is having more soft stools. It might not necessarily help you with the pushing or the coordination, and those are other things which need other kind of interventions. So what can you do to make the stools a little bit softer? First of all, we say increase your fiber intake. The advice here is a bit confusing. We say between 25 to 30 grams per day. What does that really mean? It's quite difficult to quantify it. Just looking at the food, you may not be able to know what sort of fiber content it has. As a rule of thumb, you're probably eating less fiber than you should if you have more of a Western type of diet. Now, there are several types of fibers. There's water-soluble, insoluble fibers, but both of them tend to help. The advice here is a little bit different between someone who only suffers from constipation and someone who has IBS constipation subtype. The second part is stay hydrated, okay, which is really very linked to the fiber intake. Fibers are normally some sort of leftover foods that they don't get digested. They might get fermented by the bacteria, but they normally stay there. The fact that they stay in the stool and they form some of the bulk of the stools, they actually attract water and keep it soft. So if you do not hydrate yourself, even if you take fiber intake, it will still stay dry. So you need fiber, then hydrate. We say something around 8 to 10 cups per day. Obviously, it depends a lot on how much water you lose in a day. If you work, for example, under the sun, or if you do a lot of effort, it's a bit different. The third advice, normally people say take some sort of a probiotics or beneficial bacterial gut bacteria. You probably want to go to the more natural fermented sort of foods. Don't overdo it, especially if you have a lot of IBS symptoms. And you may try to avoid a lot of fermentation. However, things like kombucha, kefir, things like that, some people find it helpful. Again, you try, see if it helps. The fourth point here is limit high-fat diet. So fat itself makes your digestive system produce some sort of neuronal signal, hormonal signal, that they slow down the digestive system. Yeah, fat are a bit difficult to break down. So generally having high-fat diet slows down your bowel and your digestive system in general, and that may cause in more constipation. Now, the other advice, the fifth advice today, is exercise regularly. So exercising can regulate the automatic or the autonomic nervous system. It can make the software of the gut function more properly, and therefore it might actually help your digestive system just kick in a little bit better. Probably the last advice here is to consider natural laxatives. If you have tried a lot of these things and they're not working for you, then you can consider some sort of natural laxatives. Again, laxatives is a very wide, broad umbrella term. So there are the osmotic sort of laxatives, things like prune, figs, that they might actually irritate the bowel, make it produce a bit of water. So they might not be the best advice for people with irritable bowel syndrome type of constipation, because things like, prunes, they may ferment and they produce more gas. A safe bet is things like psyllium husk. Those are husks of some plants. They tend to be mainly water-soluble fibers, so they are easily tolerated. Psyllium husk you can find then the natural, form of husk. It usually comes as powder, tablets, whatever you prefer. Patients take them with water. If they find it difficult, then they mix them with all sorts of food. If that doesn't work, there are things like the senna tea, the tea leaves. Again, these are different kind of cultivations, so you may try a couple of brands to see which one works for you. So in general, those are relatively general advice about how you manage your constipation. Remember, there are alarm symptoms in constipation. Things like bleeding through the back passage, losing a lot of weight, some changes that you don't feel it's right. That is when you need to talk to a doctor to see if there are other things. But if you're happy that this is just, normal sort of constipation, then hopefully those things will help. Let us know if you have any question or two. We will try our best to get back to you if possible. Thank you very much.